Hello and welcome to the 2021 Nanaimo Work BC Job Fair. We're doing it virtually this year and we're very excited that you're able to join us and listen in on these conversations that we're having with our local employers. Today, I'm very excited to be speaking with Donovan Barabad with CBI Health Group, and Donovan is a talent acquisition specialist. Welcome, Donovan.
Thank you.
Great.
Thanks for having me.
Absolutely. So we're going to dive right into some questions here. And hopefully we can have a great conversation and let our clients and the general public kind of see on the inside of CBI Health and how they can get in.
Looking forward to it.
Great. So for you personally, how did you get started with CBI Health Group?
Well, I recently just joined the company. I would say it's going to be my second month there. And pretty much I just applied online and saw that I researched the company and saw that it has really great reviews. And I pretty much like what the company stands for. And after that, I went to the interview process and I met the team, and everyone seems to be welcoming, which is what I like and which drew me to the job. And really, I was just looking for that time. I was just looking for a role that, it really deals with the people, and I've had a lot of experience in talent acquisition. And, it's definitely a win for me for landing this role here with CBI Health Group.
That's great. That's great. And actually, you've just brought up a really important point, which is that when you look into a company's values and kind of get a sense for their culture, that lets you know so much about whether you want to be in there and a part of that. So thank you for highlighting that. That was actually one of my future questions, and we'll just skip right over that because you answered it. But that's fantastic, and it's a good it's a good lesson, I think, for people looking for work. Is oftentimes when you are looking for work, it's easy to kind of skip over things like values and culture, because you're often in the position that you really need a job. But that's an important piece as well, and shouldn't be skipped. So regarding the position that you're looking for right now at CBI Health Group, can you describe a little bit about what position you're looking to fill?
Definitely. So we, for my role, I pretty much recruit for a lot of healthcare aides. That's what we are currently looking for. Mainly, the role is providing home care. So care aides will be going from home to home in the designated area and where they're assigned, and pretty much providing home care, personal care to any of the clients for the patients for that area. So there are also oftentimes where I would hire for LPNs, nurses, registered nurses and whatnot. And we do have a few office roles, but just at this moment, not much, but it's mainly just healthcare aides and a few registered nurses and all that.
Okay. And it sounds like you're sort of hiring in an ongoing process. So if I were to ask something like, when is this position to start, I'd imagine it would be kind of whenever you can get your hands on a qualified candidate.
Yeah, sort of in a way. Currently, with how COVID-19 works, we are trying to limit our orientation. So orientation right now happens every 3 weeks, I believe. And I guess I'm just hiring within the interval, and whatever a candidate kind of closely aligns to the orientation date, pretty much.
Okay, great, perfect. Now, with regards to orientation and when someone starts in the position, what is your onboarding process like, and what kind of training is available to new hires?
For sure. In terms of the onboarding process, orientation is pretty much done virtually, and it is done within 2 days. And depending what position you're doing, if you were hired as a clinical role, so that would be a healthcare aide and all that, a portion of it would be an HR portion, would be talking about the policies, the procedures, about the things you need to do with the company, a little bit of an introduction with the company as well. And in terms of training, I believe it's done as well. For some part of it would be virtually, and there are also often times where the healthcare aides would be paired up with another healthcare aide to kind of just shadow them while they're doing the job. So we're pretty much taking precaution of how COVID-19 is. It's pretty much changed the way we do things. I'm sure it is for some companies too, but it's pretty much a lot of shadowing and a mix of a virtual online training, for sure.
Right. Okay, great. And you'd mentioned LPNs as well. So if someone's brought in as an HCA, is it often the case that an HCA is sort of pursuing the LPN route, and do you support them in that process? How does that work?
From my understanding, we do take in HAs, and some of them they are in the process of completing their LPN education, right? And whenever they finish it, and whenever there is a role available, definitely we would assess their performance and see from there if they'd be suitable for this role. And again, seeing their performance for the past 2 years or maybe months, or depending on when or how long they've worked with a company, that's definitely something that we consider. And it is possible for healthcare aides to move into a nurse role, depending if they meet the criteria of education and things like that, for sure.
Okay, great. Perfect. Okay, so you'd mentioned COVID-19. Of course, it's hard to ignore. And I'm curious, for CBI Health Group, what kind of safety precautions and safety measures have been put in place as a result of COVID-19?
Well, since we are in the healthcare field, we are really taking COVID-19 seriously, and we are really enforcing our COVID-19 policies. So from my understanding, depending on what role you are, I guess if you're in an office role, you would need to notify the managers prior to coming into the office if you need to, and you would need to fill out a survey, screening if you've had any symptoms in the past few days or weeks and all that. And we also have a tracker that keeps track of the people who are experiencing symptoms. And for that, they would need to get tested and all that and call 811, which is recommended by the government. And in terms of people in the front line, so this would be the healthcare aides, nurses, and all that, it's strictly that they would need to be wearing proper PPE. So this would be face shields, face masks, coverings, and all that, and which are definitely supplied by the company as well.
So for the role you're looking to fill, and for roles that you're looking to fill in the future as well, what are the characteristics of an ideal candidate that you're really looking for?
For sure. So what I really look for is a lot of compassion, someone who has empathy, and people who have really great, I guess, customer service skills. Because in a way, it is still customer service because you are providing service to a client or a patient. I mean, there definitely is a technical aspect, which is knowing how to do the job or having previous experience. For sure, that's also as equally important, but definitely someone with the right personality and someone who's able to handle different kinds of scenarios, because you may not know what happens with some of the patients, because sometimes patients, they would have definitely different moods and all that. They could be angry, and someone who knows how to deal with stressful situations as well. That's something that I look for. So for sure, in terms of what I look for, it's a lot of customer service experience and as well as technical knowledge.
Great, fantastic. And I think you've highlighted a really good point as well. And I know that we'll get into the kind of interview and application process a little later in our talk.
Sure.
But one thing I think that you've highlighted is if you're looking for someone who can demonstrate empathy and compassion, for those job seekers who are looking to form your application for practice your interviewing, coming up with examples from your life where you can show that you've demonstrated compassion and empathy, even if it's not directly in the role that you're looking to get into, that's still really valuable. And what we do, what we train our clients is to use something called the STAR method, which is when you're recounting a story in a job interview, to go through STAR, which is situation. So what was the situation you were in? What was your task in this situation? The action that you took, and the result of sort of how did the situation improve as a result of you doing what you did? And so if we're speaking about compassion and empathy, boy, that could be something like an irate grandparent coming after you about something. And how did you handle that? How did you handle a stressful situation? So even if something isn't directly related to the role you're going to be performing, it's good to take note of these things and sort of and capture them in your own mind and in the way you tell your story. So thank you, Donovan, for bringing that up. So I'm hoping that anyone that gets into the position will want to be successful. That's a goal. Why wouldn't it be?
Yes.
So for CBI Health Group, how do you measure success? How do you know whether someone is successful in their role?
So from my understanding, building on the previous answer. So definitely something that I look for is customer service. Again, it's really equally as important to hearing feedback from the client and the patient, and in terms of how well the care aide or the nurse took care of them during their work hours, and pretty much I guess their attitude, I guess their motivation to wanting to move up too. That's something that we look for in terms of moving up for sure. But definitely there is lots of room to grow. We've had people move on to supervisory roles as well, starting off in nursing roles and all that. But for sure is something that we really heavily look upon is the feedback from the patient and the client. It's pretty much what we look for.
Okay, great. So when you're posting positions and you're accepting applications, what are the sorts of things you're looking for that your talent acquisition specialist eyes are looking for when someone sends in their resume?
Yes, so a lot of things. Definitely when I see someone's resume, the first place I'm going to look for is their education, seeing that they have that technical knowledge, seeing that they have the background in doing the role. So in BC, there's various healthcare assistant programs, and if they are qualified for having practicum hours, which is really important for the role and gives them that hands-on experience in terms of dealing with the patients and the clients. Another thing that I look for is their work experience, seeing where they've worked previously. For some positions, we take on new grads, and for some positions, we do take on a few more experienced workers. It really, again, it depends on the client's needs. And another thing that I look for in terms for the application is seeing if whether they meet the application screening questions towards the beginning of the application process. So this could be, if them being registered with the care aid registry or the BCCNP with the nursing registry, looking at that. A few more things as well, such as having a negative TB test, tuberculosis, because you are going to be dealing with patients, and it's really important to have that negative result. And yeah, it's pretty much all those things.
Okay, great, perfect. And any tips that kind of come to mind of resumes that really stood out to you?
Yes.
Either it could be from a formatting standpoint or anything else, really.
You know what? I really like resumes that are laid out. It has headers at the top, so a section where it says, job experience or work experience, and then the dates are really important to me too. Seeing how long you've worked at the role and seeing, if maybe you jump different jobs. That's definitely something that I look for as well. Something that's clearly written, and a lot like their contact information is also important to be put on the resume. That way I'll have a way to contact you. And really it's and having this little section at the bottom for education, it's really important. Mm-hmm.
So thank you so much for those resume tips. So a cover letter. So there are different kind of positions when it comes to cover letters. Do you look for them? Do you accept them? What's your position on cover letters?
Well, to be fairly honest, I do accept them. I think it's a good supplement to have on top of your resume, and I do read them from time to time. It's really equally as important as well. What I really look for when you're submitting a cover letter is, I guess, your motivation as to why you're applying with us, and just maybe a little brief bit about your experience. So yes, I do look into the cover letters for sure.
That's perfect. And what's great about what you just said about cover letters is that what a lot of people do when they create a cover letter is they kind of take the lazy approach and they just take what's on their resume and then put it into kind of written form.
Yes.
So you're just reading two versions of the same thing. And what you've just highlighted is, putting your motivation on there. Your motivation isn't really what you'll find on a resume. And your story isn't really what you'll find on a resume. And so your cover letter is a great opportunity to get into those and to let the recruiter know exactly who you are and why it is you're applying. So thank you.
Yeah, no worries. Yeah, so I guess something that supplements the resume and something that isn't necessarily in your resume. So maybe extra bits about you that I would like to know. Yeah.
So for those looking to get themselves into CBI Health Group, what's the application process like?
For sure. Well, the initial would be first contact with me. That would be me calling you and going through a normal phone screen and asking you some questions that and ranking it against the job description or the job that I'm recruiting for. And if it's a match, I would then forward your application and your resume and whatnot to the hiring manager for that area. And we will be discussing with what we talked about during the phone screen and seeing if you would like to move forward. And if the manager does want to move forward with you, they will contact you personally, or I will contact you personally, and they would schedule you a virtual interview online. And from then on, you will be scheduled for an hour interview. And depending on what positions, there may be a skills assessment for the part of the interview, as well as a Q&A portion. And after that, when that is good, the manager will reach out to me telling me how it went. And then I will then proceed on to the next stage, which is pretty much collecting the necessary documents, which is what I mentioned earlier, to verify your education, to verify if you're registered and all of that, and some the TB test. We will probably do a police clearance and all that. And from then on, it's just pretty straightforward. From there, I would then proceed with the offer, and then orientation. Pretty straightforward. It's quite a lengthy process, but yeah, I'll pretty much update every step in the way.
Oh, perfect. Oh, that's awesome that you can help people along in the process, because it does sound as well like it can be a bit of a lengthy process, but I think that the length of the application process speaks to the importance of having the right person in the role. If it was a very, very quick 1-day turnaround of application one day and hiring the next, then it's really difficult to know if you've gotten the right person into that role.
Yeah, no worries. I'm here to just make the application process as quick as possible for you, so you can get started working, or as more efficient and easy, if you can say that.
So, of course, you mentioned the virtual interview. Almost all interviews have gone virtual these days.
Yes.
So what can someone expect from that interview? Is it just one person interviewing them? Is it kind of a virtual panel? What does that look like?
Yeah, so most of the time it's going to be one-on-one with the care manager for that area. And it's going to be one-on-one you and the manager. And then how, I guess I can speak about how it's laid out. So the first portion of it would be a Q&A. We'll ask you questions like, situational and behavioral questions and all that. And the last bit would probably be a skills assessment, just to really just test your knowledge. I guess, for example, would be the healthcare aide position. We'll just ask a few questions regarding in terms of the healthcare aide role. So it's pretty straightforward, just one-on-one with a manager if they're available.
Okay, Donovan. Well, that was our final question. You did fantastically well. Your answers were amazing.
Thank you.
And what I'll do is I'll thank you for your time, and I will also let everyone know that, Donovan, your email address is going to be available for anyone who wants to reach out to you. And I would say for any of those of you who would like to reach out to Donovan, either to apply for a position or just to ask more questions, to make mention of the fact that you watched this interview between Donovan and myself. That way, Donovan will know that you've done your due diligence and you've learned a little bit about what CBI Health Group is all about. And it also gives us a way to know kind of how successful we were with this process. We want to know that people have taken action as a result of seeing this video. So thank you very much, Donovan. And I hope you have a wonderful day.
Thank you so much. Thank you for your time.